Hi, everyone. Thank you for joining. My name is Naisha. I am a BC from the Skincare Center. And today I want to talk about my difficult case, which is obtaining a dual therapy. Amy, if you want to go to
Uh,
the next slide.
Yeah, I think everyone's getting settled. I think a couple of people have
Uh,
made it in from the waiting room. So, yes, let's get started.
all right. For everyone, I would like to say you should be coming to the BCoD conference this year in Fort Lauderdale. And
Whoop, whoop.
I'll give you my reasons. Number one, because we're on the beach. No, but seriously, I would definitely say you guys should attend is because number one, there will be some great takeaways. For instance, the networking, you'll meet a lot of you'll meet a lot of people, you'll learn, this will advance your skills, this will, help your patients and even help you. And also, I feel like when I came to the BOCD conference myself, there was a lot of great opportunities. So definitely come to the BCOD conference in Fort Lauderdale, and besides, I'll be there. So that's another great takeaway. Just joking. Um,
Yes, we would love to see everybody's faces in person, live.
yes,
I think that's a
definitely.
great takeaway, Naisha.
Same, Tammy, same.
Oh, and then don't forget about the all access badge for $49, which, it includes, the breakfast, the lunches, and other educational sessions. And then also the $49 would be used to credit towards your room. So it's definitely a great resource, definitely a great opportunity. And I say money well spent.
Amen.
Mm.
All right, Amy,
I
if
have
you
a silly question.
sure.
Yeah,
So, if this is your first year as a BC, would you recommend going to the conference?
Yes,
100%. Yes.
definitely.
Yes, yes, yes.
Okay. I mean, I've been in Durham for, I'm going on 4 years now, but I just I fully stepped into the role of a BC in October. So, I'm coming up on a year of being a BC. So,
Exciting.
Yes,
Congratulations.
thank
congrats.
you.
Congrats.
So,
Yeah, definitely. That'll
I've
be
been
an
speaking
awesome
with my
anniversary present.
manager about it, and we're talking about me coming down there, um, for that. So we're just
Mm,
trying to get the doctors to approve it, but it sounds interesting. So I'm looking forward to doing it.
Brooke,
Well,
yeah.
it's like
I hope
perfect
we hope we see you there.
Yes.
All right. Well, I am going
Oh,
to
Tammy,
start.
sorry, you
Go
were
ahead.
saying something, Tammy?
Oh, I was just saying, Brooke, it sounds like it's perfect timing for you. If you've already got a year under your belt, you kind of know, the ins and outs, like the basic stuff, and probably even more than that. But this is a
Yeah.
way to get like a broad spectrum of things that maybe you don't have a full understanding of or don't know how to navigate. And I can tell you that the networking aspect alone is worth every penny. Every
Oh,
penny.
cool. That sounds great.
Yes, and building that community to be able to have like a text group of people to just reach out to you and be like, "Hey, I saw this happen. What are you doing in this?" Just like we're doing tonight, it's amazing. And then I also wanted to mention, Brooke, before we move on to the next slide, the manager approval kit and the scholarship program. Reach out if you need any of that, like the support letters and stuff like that, to share with your manager,
Uh-huh.
um, to get assistance in getting them to sponsor you to come to BCOD.
Okay.
Definitely.
Sounds good.
All right.
Yeah, yeah, exciting. Yeah, yeah. Hopefully
Yeah.
you can make it.
Yeah. All right. Well, I am going to give you a little bit of patient history. So this patient, her insurance was Forward Health, which is it's like a Medicaid for Wisconsin. She's a
Mhm.
45-year-old female. So she was diagnosed with atopic derm and then moderate to severe plaque psoriasis. And she also had uveitis in the right eye. So I feel like this is a slightly difficult, but kind of a weird kind of a case to me, kind of interesting. And so for me, the challenge was getting Medicaid basically to approve 2 biologics because technically this is kind of off-label use. And then off-label use, and then most plans will like really never cover 2 biologics at the same time. But in the end, after some months going back and forth, they ended up, after we did like a state fair hearing, or I guess whatever you want to call it, they ended up approving both biologics. You want to go to the next slide? And so the next slide, it just talks about the immune pathways with the IL-13 and then the IL-23. Basically, a single biologic. Basically, one biologic could not help this patient, and that's what the provider felt. Felt like after him seeing this patient for like months on, he just felt like she needed to be on 2 biologics. I was just kind of skeptical because I was like, you know what, I think this is going to be really difficult. I don't know if this is really going to work. I mean, and my provider was like, I'm shocked you're not up for a challenge. And I was like, I normally am up for a challenge, but I just feel like because I'm new to Wisconsin, Minga, BC, and Wisconsin, I really didn't know too much about their Medicaid because, as everyone know, in each state, every insurance has a different set of rules, and they play different. And so
Which Medicaid in Wisconsin was it? Did you say? I'm sorry.
Forward Health.
Oh yeah, I got a lot of Forward Health.
Yes. And so the thing with it has, David, with Forward Health, the thing is, we personally can't even submit to Forward Health. We have to go through like a pharmacy or like a third party. And so basically, we still get the prior authorization forms and we still have to submit the clinicals, but we can't even submit. Like when I was in Illinois, like when they had Meridian, I can just send straight to Meridian. No, you have to go through a third party with Forward.
And you have to submit through their portal. And then
Well,
I have actually,
you can, but we can't.
yeah. And then I have actually seen some PAs with Forward Health take up to 30 to 40 days.
Yes. Oh, yes. They take a long time. Yeah, a long, long time. And so her BSA actually started out, it was actually, I think it was like 80 something, but right now, it was, in the form, it was like 55% because we were giving her samples of both medications. So this is why it ended up being 55%. And the itch score, it was a 6 at the time. It was a 6 out of 10. But when she first started, I think it was actually a 9, somewhere around a 9. The areas, they were pretty itchy. She was bleeding. I mean, she couldn't sleep. I mean, the pictures that the MAs took, I mean, it looked really, really bad. So to me, I think she met the step therapy, or for her to even start a biologic. So she only tried steroids, which was clobetasol and triamcinolone. And to me, it made the areas really aggressive. It didn't do anything. So that's why the provider, he moved forward with me submitting the third party Evergreen Pharmacy, submitting the prior authorization for the 2 therapies. When I submitted, oh, sorry, Amy, I'm like, didn't even tell you to like go on. I'm like just talking. I am so sorry, everybody. I'm like literally just going on about this because I kind of know this like in the back of my mind. I apologize.
Oh, no worries. Here's the slide with the disease severity.
Yes, and this is the disease severity. As I was talking about, she was pretty like itchy, like flaky. It was pretty thick. I mean, she couldn't sleep. I mean, she was like, there was times where she was bleeding. Her scalp was like, just like you could just see the thick dandruffs. Like, yeah, it was just really thick. And so her treatments, She just tried like topical steroids, which was clobetasol ointment, triamcinolone cream, and none of that stuff really worked. The doctor felt like it made it worse. It didn't help at all.
Mhm.
All right, next slide. And so what he came up with, and the other physician assistant, what they came up with was trying Tremfya for the psoriasis, and then Epiglys for the atopic dermatitis. And so let me tell you how they actually even determined that she had both. So he did a biopsy on like the leg, and it came back has psoriasis. And so she had a biopsy at a previous dermatology office, and they did like what do they call that? Gosh, a punch bite. Well, same thing. A punch. They did a punch biopsy, like in the crease of her arms. What do you call that? Like the arm folds. And that came back has, as you would say, eczematous dermatitis. So that's how they determined that she had the psoriasis and the atopic dermatitis. Now, when I first submitted the prior authorization, I actually did not have the punch biopsy results for the atopic dermatitis. And this is why I say that it's important it's important to have good documentation. It's important to ask the right questions. It's just important to gather as much as you can, because the MA who actually took the chief complaint forgot to put that she saw several other dermatologists and that she actually had a punch biopsy done. And
Mm.
so, yeah, she was just missing like a lot of information. And so I didn't have a lot of the good information.
Mhm.
And so again, it was denied because it did say experimental. Then it said that step therapy wasn't met. And the first appeal that I submitted, I actually submitted like pictures. I submitted that, the topical steroids, that they were really ineffective. I had her get like a letter, from her husband. I actually ended up getting a letter and some records from one of her dermatologist offices that she was previously seen at. And so they basically, denied it and said that I didn't have enough evidence for the dual therapy. And so this is where AI comes in. I love AI because AI actually did help me prepare. It helps me, find some literature. And actually, another good thing is when the patient actually came into the office for a sample, I noticed that she wore glasses. And I asked her, hey, can I see can I get your ophthalmologist information? Because I just want to, pull some records out because, anything may help. And so actually, when I got the records back from the ophthalmologist, she had uveitis in her right eye, and she was actually taking prednisolone eye drops. So I know that one of the side effects or issues from Dupixent is that a patient can have like eye issues. And so that was something that I actually I put, because you could tell Chat GBT like how to write your appeal or how to write your letters, or you could tell it whatever. So I actually told Chat GBT, I was like, put it in some of the old information that I had. I referenced some literature, some information out of a literature, a publication. I had that put into one of my, well, actually into my letter. I actually got the report confirming that she had uveitis. I actually and I actually submitted both. I ended up getting the punch biopsy results that confirm that she had atopic dermatitis. I had the biopsy that we had that was confirming psoriasis. I put in the pictures. I kind of put in like pretty much like I went full force with it. And I had Chat GBT I told it to give me a nice strong um, appeal letter with all this information in there. And it kind of gave me all that information. It gave me a great argument. as to why patients should be on 2 biologics and how the 2 biologics would help both of her 2 diseases. And actually, I wish I should have, and what I should have did is like actually put a copy of that letter, which I'll give it to Kristen to see how, I can let everybody see it. But honestly, Chat GBT like really, really did an amazing job. And to be honest, I really should be thanking Chat GBT because it really did help me out. I mean, and
Yeah.
one,
But you drove it, Naisha. Don't give it all to ChatGPT. You gave it what you needed from it and then took out of it from it, what you needed. So it was you.
yeah, yeah, it was me. And in this case, and it went up to the medical fair hearing, and like I said, it like David said, it took like a long. I mean, like this actually, I've kind of been going back and forth with this. Oh my God, for at least I want to say 6 months
Mm.
because their Medicaid really, like David said, their Medicaid really does take time, a long time, and
Unfortunately.
yeah, unfortunately, and I mean, literally, it takes a long time. But I mean, it literally got approved, and it really made my day. And I kind of was like, I felt like a big relief just was like off my shoulder because I mean, literally, as I can't stress enough, and I know we all stress this, is that documentation is important. Asking the right questions, being observant. I feel like even being observant with when a patient comes in is important because just by me seeing that she was wearing glasses, and then too, also I have my son has uveitis, and so just asking the right questions and just asking questions period, and just paying attention to patients, medical history, medication history, and even it has a new has I can't even talk. When a patient comes to you and they're coming from a different place or they're new, it's always good to ask the patient, hey, have you seen another dermatologist? Have you seen a rheumatologist? Have you seen your PCP, or have you went to a medical spa? I mean, just asking them anything. I mean, I feel like any little piece of information helps, and it just goes a long way. So that's it for me.
Well, Naisha, I have to tell you, great job. I mean, AI, it does help us write the appeal letters, but like Amy said, it's like you putting the information in. I mean, AI can't do that by itself, and AI certainly didn't look at your patient and know that they had an eye issue. That was a great catch on your part because obviously the MA maybe in the visit didn't even put two and two together. So congratulations on winning for your patient.
Thank you. Thank you. Trying to see, is there any questions or anything that anybody else want to add? And just, I don't know. Like I said,
Um, the AI tool that I really like that was talked about at the conference, the open evidence, it has been super helpful on all my really hard appeals.
hmm
And then new thing from Castle Biosciences or Decision DDX, if you have it,
mm
they are able to take a skin scraping of your atopic dermatitis and tell you exactly what it would respond to. So whether that's your Rinvoq or your um,
hmm
Dupixent. So you can I've been submitting that as well,
hmm
saying like the longer you put off the appropriate treatment, the more expensive it is going to be for the insurance.
hmm Thank you for that.
And they're not balance billing the patients. So
hmm
if your office uses them, they might get oh my gosh, that's really expensive. But also it gets them to treatment faster and are having better scores with atopic dermatitis clearance, and like the PASI scoring is like showing really great data because patients are going and starting on the right first therapy.
Well, that's good. They use Biocastle. I don't know.
Wait, you said that was with the skin scraping sent to Castlebot?
Castle Biosciences has it, and one of our doctors called it Decision DDX. So it's where you send, at least at our clinic, we send our melanoma samples to
Yes.
do the
Yeah.
Breslow test and yeah, and they also happen to add this one. It's new as of April 1st.
Mm.
Okay.
And
I'll let our providers know because I mean I'm with Forefront, so
oh,
we
we are
yeah.
too. It's
Okay.
brand new. So if you see my name, you can send me a message and I can send you the protocol that we have for our office. We haven't started it yet because
Hmm.
most of everybody has been easy starts. But if they
Yeah.
have a weird rash and you have a biopsy proven psoriasis and proven atopic dermatitis, I submit both of those. And then the Castle Biosciences does a test to see what it would respond to. Their psoriasis tests are not as promising right now, but they are working on it.
Yeah,
Oh,
that would be
thank you for
nice.
that.
Oh my gosh, these people, like, I would hate for people to be delayed and delayed and delayed or try 8 different medications to
Mhm.
finally get on something that works.
Exactly.
Correct.
Thank you for sharing that, Anna. I had gotten the memo from Castle Biosciences, and I knew about the melanoma, but we haven't used that yet. And I was curious how it was really working out, and it sounds like it's doing great for you guys. So I'm going to bring that
Yeah.
to the provider.
Yeah,
I'm gonna-
absolutely. And if you shoot me an email, um, I can send you the stuff that I have for our clinic for Forefront here in Montana.
Can you put your email in the
Yeah,
Yeah,
put
chat?
your email in the chat,
Please.
Yeah, I'm
please.
gonna
yes,
put mine in there.
absolutely. And then the open evidence is free for providers to enroll. So I just got one of our providers to say, yep, you can enroll in it. And it's linked, pulls all those resources. Super great appeal letter writing because I can only write so many in a day.
Yeah, I signed up for open evidence too. I found out from another biologic coordinator when I was networking, and
Mhm.
signed in and looked it up, and it's great. It really cites a bunch of cases, very detailed, very specific, and a lot of wins with that.
Mm-hmm.
That's good. Hold on, let me get that other email too. Perfect. A lot of good information. This is why I'm so glad that we have the monthly webinars.
I
This is,
these monthly
To just
webinars.
kind of check in with everybody and see what's
Mhm.
Well, this helps me because I keep getting denials because they might have a diagnosis of atopic dermatitis, so they're requiring a biopsy proven for psoriasis and for delays.
So they just keep getting
So
at
Anna,
all.
one of the
Oh, and anyone else?